I'm Dr. Natalie Marks, and we're here with another quick cup of knowledge. Joining me today is Dr. Sue Ettinger, who's a medical oncologist and also known as Dr. Sue Cancer Vet. Thanks so much for joining us.
Thank you for having me.
Absolutely, and I'm very drawn to you because of your mentorship and education awareness, but you have such a great outlook that I think a lot of our listeners want to know about dealing with oncology every day. A lot of people think, gosh, it really sounds depressing or would really be draining, but I'd love to hear your outlook because I think it will really inspire a lot of others.
Yeah, I mean, both when I talk to veterinary professionals and family members and just pet owners, people think, oh, your job must be so depressing, how do you come home? And they just, because there's so many myths and misconceptions, and I actually love what I do, and there are days that suck, to be honest, and there are days that are depressing, and there are days that we lose patients. But I really try to focus on the good. And patients, our chemo patients, tolerate chemo so well. And what motivates me is the quality of time that our patients get, and they live longer and they live well. And it's the thank yous that I get. So there'll be patients that we lose, and I get email messages and messages on social media, and the clients are thanking me for the quality of time. And they say, because of you, we got 6 months longer. Because of you, we had Remy, 9 months more than we expected to have him. And he got to go to the park, and he got to swim, and he got to go up to Vermont with us. And those are the things that keep me going. It's the quality of time and the time that I'm giving these pets with their families.
Yeah, and that's really, I think this glass half full is really the way to look at it, because for a lot of people, a month is a lot of time, right?
Yeah, and I think the other thing that gets me, that really sort of makes me so happy is I know that people are coming to me on their worst day, right? They know because it's the general practitioner who has the worst job. They have to break the bad news that the pet has cancer or that they're suspicious has cancer. And then people are coming to me and they're so scared and they're heartbroken and they don't trust me. I'm this new person coming in. I'm the specialist using all these big fancy words, and they're so scared. And I go in there and I feel like I make this connection. Sometimes we hug and I walk out of the room and I know that I'm doing good. And I turned to my nurse and I said, that was good. Like we're doing some good today. And sometimes they're going to treat and sometimes they're not going to treat. But I feel like I've given them options and I've given them hope. And that's what gets me up and gets me going to work every day.
And you mentioned you turn to your nurse and say, I've done something good here, but you have a great way of putting that work culture out with all of your team. Can you talk a little more about that?
Yeah, so I tell my nurses every day, I can't do what I do without them. And I think that you have to have a really awesome team. And I'm going to be completely honest. I've had teams that I've struggled with, and I've had teams that I haven't clicked with. I'm not the perfect person to work for, and I've had people that haven't been the perfect people to work with. So, it's not always perfect. But I've had some amazing teams that over the years, and I tell them all the time, I can't do what I do without you. So, I'm only one person, and there are days that we're given a lot of chemo, and we're seeing a lot of new appointments and doing CT scans and x-rays and cytology. And so you have to have systems in place to be able to safely and effectively see cases, give chemotherapy, and give compassionate care to the clients and take care of your team. So for me, we have our morning rounds and afternoon rounds, and we huddle and we just make sure that we're communicating effectively and that we're having a good time, because we all spend a lot of time at work, right?
Yes.
And so, and maybe you're not going to, like I said, there are some people that just don't fit well. Mm-hmm. And so maybe they're not the right person to be on my team. But when you have the right team, it really works. It works well.
Absolutely. Shifting gears a little bit, there's a lot of graduating students that are going to be listening to this who might be thinking oncology is a bit intimidating, or I don't even know how I would go into a room and break that bad news. Can you give them some tips, some pearls that they can start with as they begin their journey in practice of, how can we be successful in this arena?
Yeah, and I think one of the things that really is sort of overwhelming about cancers. There's so many different cancers, right? There's lymphoma and hemangiosarcoma and osteosarcoma, and there's all these statistics and response rates and what drugs do I use and protocols, and it gets really, really overwhelming. And vets will call me and they'll be like, I just diagnosed osteosarcoma and I haven't seen one in a couple of months. What stats do I need to know? And what I remind everyone is it's not what you know, it's how you say it. Mm-hmm. And it's important to, obviously understand why cancer occurs and what's the best way to treat it and the best diagnostics. But how you break that bad news will make or break it for the owner. So, a couple of really important tips when you go into the room. For me, a couple of things are empathy. So I always say, like, we're all rooting for the whatever patients. We're all rooting for Ollie. You want them to know we're a part of this team. This is not the news we were expecting. You want the client to know that we are a part of this team. And one of the most important things is, I love this phrase, it's the chunk and check method. When you go in the room, if you just start like, here's the lymphoma spiel, you're really gonna lose the client. So you wanna give them little chunks of information and then check for understanding with open-ended questions. So we could spend lots of time talking about good ways of breaking bad news, but I think the take-home message is, it's not the statistics, it's not what you know about lymphoma, it's how you break the bad news that's really going to make or break that bad news for the owner. And then you can get into what tests do we need to run for lymphoma and what are the different chemotherapy protocols.
And how do you find working with small animal practitioners in day practice that you develop a really good referral relationship? Like what kind of tips do you suggest to them so that your relationship and the team approach is the most successful to everyone and the client?
Yeah, and I think, what I've learned, because I lecture all over the country, is that in different parts of the country, different things are going to work for different general practitioners. There are some, in the world of cancer, right? There are some parts of the country, like I'm in Metro New York, there's a lot of oncologists in that area, so it's going to be easier to refer. So I think as a general practitioner, you're going to say, well, I'm going to work up these cases and make the diagnosis, and then I'm going to refer. So you want to get on the phone, you want to meet your oncologist and really have a good relationship and say, maybe as a general practitioner, you're really comfortable doing surgery. So you say, well, I'm going to send it to you for chemo, but I want to do the surgery. I think you just have to have an open dialogue. And I think where I've seen over the years where that relationship breaks down is where the general practitioner and the specialist aren't communicating with what they want to do. There are parts of the country where it's 8 hours to see a cancer specialist. And so that's where I see general practitioners doing more chemotherapy. And that, they're filling that need that really needs to be done. So they're going to my lectures and they're learning more, so sometimes I'll say, hey, how many of you are giving chemotherapy? And it will really vary on the parts of the country. So I think as a general practitioner, you just have to figure out, what are you comfortable doing? What is your practice comfortable doing? What can you do in your area? And then obviously figuring out the safety regulations, because those are actually really changing in veterinary medicine today as well. Right. So, figuring out what you want to do, what can you do, and what, your practice can do.
And you mentioned lectures, and obviously there's a lot of online learning, but what are some other resources that veterinarians can go to learn more about oncology? I know you've got your YouTube channel, if you want to talk a little more about that.
Yeah, so I've been doing a little bit more on different social media channels. So my YouTube channel, I started out by doing vlogs. So this is a way that I wanted both veterinary professionals and pet owners to kind of see what goes on behind the scenes. So, and just a fun way of sharing what goes on at my oncology practice, the different ones that I've been at. But now I'm trying to do more informational things. So once a month I do live Q&As for pet owners on Facebook, but the easiest way to find them is on YouTube, because you can go to that playlist. I also have informational videos like myths and misconceptions about cancer and chemotherapy. What are the top supplements that I recommend? What medications should your pet be on if they're on chemotherapy? So as a practitioner, maybe you've just diagnosed a pet with cancer and the owner's like so overwhelmed, you're like, okay, well, here's a good resource for you. Go to Dr. Sue's YouTube channel. For vet professionals, I actually have a closed Facebook channel with almost 3,000 members, and if people want to ask questions, they want to ask me a case, I say put it in the Facebook group, because then we can all learn from each other as opposed to me just emailing you one-on-one. So people will pop cytology up there, we'll put RADs up there, and then we can all learn from that as well. And then I try to do office hours in the closed Facebook group just for vet professionals, a safe place, and we do that about once a month as well. So Facebook and YouTube are really sort of good information spaces for both veterinary professionals and pet owners.
Awesome. Well, you've given us such great pearls to take home, very inspiring, and thank you for all you do for the profession.
Well, thank you.
Have a wonderful time at the conference.
Thank you for having me. I love it here.
Oh, thank you.